Hi, everybody. I'm just going to open up my PowerPoint here. Get started. Awesome. So if you could just let me know, Amelia, if you only see one slide or two.
I see one slide. It's perfect. And I just want to mention to everyone too to please hold questions to the end and feel free to use that Q&A box down at the bottom, or if you need to reach me, you can comment in the chat and I can help you out with anything.
Perfect. Thank you so much. So thank you for everyone who is attending live, as well as to all the lovely people who will be watching the recording. I'm Tabitha Kucera, and I'm here to talk about a very important topic, no more fraidy cats, cat-friendly vet visits. I want to thank San Diego Humane Society and Fair Free for having events like this, because cats seeing the vet is a very important thing, as well as dogs. And understandably, stress affects why cats don't see the vet sometimes more often than you would think, not just based on my experience as a veterinary technician, but also research tells us it too. So in this lecture, I'll be talking about why does your cat need to see the vet? Because sometimes you hear some myths, hey, my cat's indoors. And, I don't travel the world, but I'm still prone to disease processes and things. And I still need to see, ideally, a general practitioner at least once a year in a perfect world, maybe more, depending on my medical stuff and your cats. So we're going to talk a little bit about that, how to be a cavacate. It's a super fun pun, an advocate for your cat. And then a little bit about some of those hurdles to the stress associated with vet visits. So what we can do to help our cats love their carriers and love the car, and then things that you can do, even if your veterinarian may not be practicing some of the things I mentioned. You can do a lot to help your cat have a more positive experience at the vet. And then the vet and the veterinary professionals you're working with see that, and then they start to do those things to reduce fear and stress for the cats in their care. So it's pretty great. So first things first, these are some alarming statistics, but this is very real. So cats are the #1 pet in the US household, and 50% of those cats do not receive annual wellness checks. Of the 83% of cats that are taken to the vet in the first year of ownership, so maybe when you first adopt your cat, or they come to you, because so many of us find cats outside, over half of them don't return. So not only they don't return for annual, so preventative care, but also reactive care. So when their cats are showing symptoms. And 50% of cat owners report that their cats hate going to the vet, and 38%, which is a pretty big amount, just the thought of them taking their cat to the vet caused them stress, just thinking about it. So as you can imagine, I'm sure that all of these things, including the stress associated with the vet, affect why we're not seeing cats as much as ideally I would like to. So of course, there's always room to improve. We're always getting better. So again, here are some more statistics based on some recent studies that were done. So in that same study I mentioned before, 9.6% of the cats owned in the US will never see a vet. 27 will only see a vet when they're sick. And when I say sick, when the caregiver identifies that the cat is sick, but we'll get more into that because I'm a veterinary technician and a behavior consultant. So I tend, of course, to understand when a cat is showing things that I'm concerned of that needs to get where they need to get into the vet before maybe a caregiver would, because I'm a veterinary professional. 81% of cat owners believe their cats are self-sufficient. So what that means is that myth that I was talking about before, a lot of people just don't feel like cats need to see the vet. And it's a really, really common myth. So I'm here to bust that myth because they do need to see the vet. And of course, veterinary deserts and lack of access to veterinary care is a very real problem, but that's another lecture. And thankfully, we're doing a lot to help with that. 4.15% say it's too hard to transport, and the thing that gets me is we all love cats. That's why you guys are all here. We see cats as veterinary professionals. More and more clients are getting them every year, but in the veterinary field, we're seeing them less and less and less, which is really concerning. So these are just a few of the reasons why veterinary visits are important. So as a behavior consultant, I see quite a lot of behavior issues, from house soiling to aggressive behaviors towards other cats, dog, or humans in the home. And a big part of that is, of course, management, safety, all that lovely stuff, but then making sure their social, mental, and physical needs are being met. And I work with them and their veterinarian to help address and rule out medical issues, because probably more than 50% of my cases, a medical issue that was either undiagnosed or maybe not managed, again, lots of different factors, was either causing or contributing to that behavior concern. So just some of the common things that we see in cats: between 50 and 90% of cats older than 4 years of age, 4 guys, suffer from some form of dental disease, which hurts. It hurts a lot. Stomatitis, tooth resorption, periodontal disease are the ones we see the most. Degenerative joint disease, also known as feline arthritis, is extremely common. And it's a really chronic, painful disease. Anybody that has arthritis or suffers from chronic pain, it affects your life. Every part of it is harder. And I meet a lot of cats who are exhibiting aggressive behaviors because they hurt, and no one has addressed or managed, for various reasons, that pain. So we see it in almost as many as 92% of cats showing some form of that. So those are just some of the most common signs of causes of pain I see that go missed, which is why annual veterinary visits are so important. Of course, be my friend slide. There it is. So segue, annual vet visits are really important in keeping your cats happy and healthy. So cats are masters of hiding pain and illness. And once you identify what that is and you know your cat, like I share with clients what I see and then they see it. So again, it's wonderful, but in many cases, we don't notice our cats aren't feeling themselves or aren't feeling well until they haven't been feeling well for a really long time. So that cat's lethargic and maybe not eating. That's not a newer thing. That cat has most likely had some pain or other underlying disease process or symptom going on for a while. But by the time that we see, right, those obvious things like withdrawn and not eating, that cat has been sick for a really long time and uncomfortable. Subtle changes can mean big problems. So subtle behavior changes can mean something big is wrong. So I always use the example of my cats all get along, and my cat was hissing at my other cat, even at a few feet away. And I was like, that's interesting, because it happens occasionally, but then I noticed it happened again. So I'm a vet tech behavior consultant who works everything up, and it's probably overkill, but my cat ended up she has a missing front leg, and she ended up having a slip disc in her back. So, and that was the first sign I noticed. And I understand not everyone is going to immediately take their cats to the vet for a full workup for various reasons, but it just tells you it's really important for us to notice those changes. Preventative care is better than reactive care, right? If I'm taking my cat to the vet once a year, or if they're seniors, twice a year, I'm going to be able to catch, and the veterinarian will be able to diagnose things sooner. So keep your cat happy, healthier. If there is something going on, they get help sooner. And it actually helps reduce your vet bills, because just like with human medicine, an emergency is going to cost a lot more money versus I knew I had this disease process or I was prone to said thing. So when I had only 1 or 2 symptoms, I went in and it wasn't a crisis, right? So you actually save money in the long run when it comes to having preventative care. Your cat may be overweight. Cats, of course, age more rapidly than humans. And I do think it's really important to develop a close relationship with your cat's veterinarian when your cat is healthy. And what I mean by that is many of us go to the vet when, again, we notice those symptoms. We don't have a close relationship with our veterinarian because we don't tend to take them for annual vet visits. So in many cases, your veterinarian, that might be the only time they're seeing them, which it's still great that you're bringing them, but that vet has no baseline. So for example, my cat gets blood work every 6 months. So complete blood count, chemistry, all that stuff. And it's not black and white, right? Every medicine's specific to the individual. And for example, my one cat has a abnormal finding on her complete blood count, but because I do preventative care and I have a close relationship with my vet, we know that that's normal for her. So because my vet is aware of my cat's normals and abnormals and what abnormals are normal for her, we're addressing things sooner. We may not do testing to rule something out that may be costly because we know that that test isn't indicated because we have that baseline. And also, all of us veterinarians and veterinary professionals are doing our best to get everybody in, but it is rough out there. So having a close relationship prior to an emergency is also helpful so you can get in with your veterinarian. So importance of veterinary visits, all very important. You guys are here today, so you probably agree with me, which is great. But let's talk about some of those hurdles when it comes to vet visits. So these are a few things. We're going to get a little bit more into each of them, but we're going to talk about how you can advocate for your cat. Because even when your veterinarian and your veterinary staff is amazing, you are their caregiver. You have a lot of information. Your information is needed, and we need you to share that with us. And also, you have to advocate for your cat. If you have chronic pain, again, I use that example a lot, you may have had to go to 5 to 6 doctors. Those doctors weren't malicious in most to all cases. It's just you really have to advocate for yourself. And this is true of our feline friends, and they can't speak for themselves. So it's even more important for us to advocate for our cats. It's really important to choose the right carrier for your cat and carrier train your cat. And then we're going to talk a little bit more about how we can decrease fear and stress by bringing their favorite things and helping them love the car. So be a advocate, yay! So when it comes to advocating for your cat, these are a few things I recommend. Be prepared with concerns, questions, cat symptoms. So if you are going to the vet, and I do this with my own human doctors, and it definitely helps me get better care because I have all this information. So for example, if you notice that your cat is vomiting, that's not normal, right? That is not normal in any context. But you're going to maybe keep just a note on your phone or a note on your fridge and write when they vomited. Was it a hairball? Was it bile, which is like the yellow stuff? Was there food? You're going to describe it. I know it's gross, but we get it. And we love pictures. Take a picture with your phone. And you're going to talk about the frequency. So, because I'll ask a caregiver, how often do they vomit? And if they're vomiting once a week versus every 3 days versus after they eat, all of this is very helpful information for that veterinarian to get an accurate diagnosis sooner. So be prepared, and be prepared with questions and concerns, because when our cats are sick, even me, I'm over threshold. I can't think or focus. I'm so worried about my cat. So I'll just take notes before I go to the vet with questions that I may have or concerns, and the vet might answer them, or the technician, before you even ask, but you have it there so you can help to get all that addressed. Learn your cat's normal. So I already talked a little bit about that. Does your cat normally greet you at the door every day? Mine does. And if they didn't one day, I would be concerned. I'd be like, that's different. I would take it and assess, but then I would continue to notice any other changes. So where are your cat's favorite resting areas? Are they still sleeping there? Are they eating consistently as per their usual? Again, they are normal. Are they going to the bathroom per their normal? So it can be really helpful to even keep a diary to track appetite, vomiting, bowel movements, especially with a cat that may have a disease process that you're aware of. That cat may have diabetes or kidney disease, or that cat may be a senior cat or a super senior cat where they're more prone to illness and disease. So you're going to keep that diary to help. Changes in your cat should not be contributed to aging. I commonly hear this, age is not a disease, right? So I'll hear things like, oh, my cat doesn't play anymore because they're older. I'm going to play when I'm older, guys. I might not jump in the mosh pit and stage dive. I might watch the show from behind or in the back, but I'm still playing. So there's a reason your cat's not playing, or your cat's a finicky eater. That's another thing I commonly hear. Usually they're a finicky eater because there's some GI upset or there's some dental issues. It's never just picky eater. But again, these are things I commonly hear. So don't contribute, my cat's just old, this is normal. It's not. And you can help your cat be more comfortable and play, right? And then every vet exam should include 2 to 3 short videos. Yay, smartphones. So I always have my clients take 2 to 3 videos of their cats acting normal. And what I mean by that, walking, their gait, playing, eating, because as a veterinary technician and behavior consultant, I see abnormal gaits or walks so frequently in consults. And that helps to tell me there's lots of signs of pain. And then I can point them out to the client, but there are things that weren't seen before. So your vet being able to see your cat in their natural environment, they may be able to see some things that are really, really helpful that they would not see in the vet practice. So I think that's a crucial part on how you can be an advocate for your kitty. Other things you can do if your cat, because again, you may be creating relationships with other vets. I have, just like for my own health, I have a physical therapist, I have a chiropractor, I have a general practitioner. So you may have multiple vets for your cat as well. And I love that. Or you might be working with a new vet. So it's important that if your cat has pain, like is painful or sensitive in an area, or any other underlying medical issues, share that with them prior to them touching the cat, right? So for example, I know that my cat has sensitivities in certain areas due to chronic pain that's being managed throughout multimodal therapy or other things. I'm going to let the veterinary technician and the veterinarian know that before they touch my cat, because as a veterinary technician, I will most likely choose to give the injection in another area if I know that patient is sensitive in an area, right? That's an easy thing I can do. So again, we really want to set our veterinary professionals up for success, but also our cats. Share your cat's triggers. So this is a pre-visit questionnaire from Fear-Free, and a lot of Fear-Free hospitals do this, but it's just one page and it literally just asks during travel to the veterinarian, does your cat urine, defecate? What have you noticed your cat doesn't like? Like you might know that your cat does not like nail trims. That's a trigger. So for example, a nail trim in most cases is not a need. It's not something that we need to do. So I'm going to get that cat's exam and blood work done. And if the cat's still doing well and not very stressed, then I will proceed with the nail trim, for example. Understand their body language. They communicate with their body language, and it's important for us to understand what they're communicating to us and maybe even sharing that, because not everybody knows cat body language. Not everyone that works with cats, whether it's in a shelter or a veterinary field, is super familiar with feline body language. So again, the more you can understand your cat, the more you can advocate for them. If your cat has a history of fear, anxiety, and stress, talk to your vet about pre-visit pharmaceuticals and handling plans. So as a behavior consultant, I work with many cats who don't have a veterinarian or haven't in a while due to the severe trauma and fear from past experiences. And I work with that client and that vet, and we create a handling plan, because handling is a skill. Handling fearful animals is a skill. And we talk about carrier training and all these other lovely things along with anti-anxiolytics. So it's not just, hey, can my cat have this thing? It's, we're going to give them this anti-anxiety medication that's situational. Plus, we're going to handle them with gentle control. We're going to carrier train them, all of these things. So I'm not going to get too much into body language since we only have a short period of time, but these are just some common signs of stress that we see in cats that are less a lot of us recognize the growling and the lunging forward or the hissing. And in many cases, those cats are, if we were to label it green, yellow, red, those cats are red. They're over threshold. And they probably showed a lot of these signs first that were maybe accidentally missed to show they were uncomfortable. So lip licking, freezing, this cat right here, you could see slightly averting their gaze. Eyes are still almond shaped, which can be fairly relaxed, but those pupils are dilated. They're lip licking. And this kitten is kind of frozen a bit in fear. Eyes are becoming wider, tension throughout the body, which whiskers are clumped together and down. Again, our animals are telling us quite a lot with their body language. So it's really important to work to learn and understand your kitty. So again, some other examples versus defensive and offensive aggression, which cats react with aggression similar to dogs in many cases due to fear, pain, and in some cases arousal. If we had to say that, obviously there's a lot of other contexts, but the number one reason is fear. So it's why we really should be doing what we can to reduce fear and stress, right? So let's get into some techniques on how to reduce stress at the vet. You are advocating for your kitty always to set up everyone for success because your input's very important. It's a team effort, right? And we're going to start with, what is a cat-friendly carrier, right? So ideally, they should have an entrance and an exit. They should have the ability to be taken apart. There's a lot of different types. Like this classic one, the plastic one with the screws, I'm a huge fan of this one. Here's another one that unzips. This one unzips from the top. Size matters. I cannot begin to tell you from a professional standpoint how many cats I see in carriers that are too small for them. And that's what's causing the high escalation in fear and stress, which I get it. If you put me in a small little, like I'm very petite, but my poor tall people who have to use the bathroom in an airplane or even sit on an airplane, you're uncomfortable the whole time. And that causes your anxiety to go up. And many cats, these carriers are not appropriately sized. So size matters. Your cat should be able to turn around, and one cat per carrier, always. That's just a fun rule that we don't have many, but there's a few. And of course, there should be ventilation and visual shields, but these are just a few types. Usually having that ability to be taken apart and large enough for your individual cat is really important. And let's make the carrier a positive place. Let's incorporate the carrier into your home. And by into your home, I don't mean in your basement where you're never at. What I mean is in an area that you are a lot. So for example, this is my lovely office. I'm here a lot, as you can imagine, and I have a carrier and a litter box and other resources that my cats need because I'm in here a lot. I have 5 cats. So I also have a carrier in my living room, and it's just a comfy resting spot. It makes a small vertical surface. It's a nice hiding spot. It's great. Put good stuff in it, like treats, toys, catnip, Silvervine, or comfy fleece blanket. We all know cats love their fleece blankets as much as I love my fleece blankets. And place familiar bedding in there. Cats love to have their scent on things. And then let's say I tell a lot of my caregivers to set up treat stations, just a mason jar with treats, and then they can easily reinforce their cats. Like they're just casually watching TV, you see your cat go in there, reinforce them. Great, right? Or you can even train your cat to go into the carrier via clicker training or positive reinforcement training. I work with a lot of caregivers to do this. This cat is adorable. And look at this adorable little face. And then we worked up to closing the carrier and moving the carrier. But again, you can clicker train your cat to go in the carrier on cue. So they're playing a part in their care. And if your cat is afraid of the carrier, because many cats I work with already have a aversion or past traumatic association with the carrier. So for example, if you hold your carrier up and your cat runs, you guys, that's a pretty severe fear reaction. I know a lot of us take that as like a joke, but that's like me holding up a pen and that person running away. I'm not going to judge them or think that's funny. Something traumatic most likely happened to them with a pen. Again, I don't know their learning history. So what we're going to do in that situation is ideally we're going to buy a new carrier to start that's appropriately sized, that can be taken apart, just to start off fresh. And I'm going to have the caregiver, even if they don't do the clicker training, and even if they don't want to do that, let's just break the other thing down a little bit. Let's start with just the bottom of the carrier. I just want the bottom of the carrier in a familiar place, not the top, not the door, and you're going to put good stuff in it. And then you might give the cat treats and play with them around the cat carrier. Because so many of us are like, they won't go in the carrier. I'm like, whoa, you're jumping too fast. If they have a fear of that, let's not just put the food in there, that they may not be ready for that. So maybe let's just start with playing with them around the carrier, giving them treats a few feet away from the carrier. And then once they're comfortable with that, adding the top, and then maybe adding the door. So again, just breaking it down a little bit. And you'd be surprised how quickly a lot of cats, even with severe trauma and past events, can actually start to enjoy the carrier. And we're changing their emotional response to how they feel about the carrier. Because just forcing them and throwing them in there, again, if you're fearful of something and I force you to do it, it makes it a lot worse in most cases, right? And then some cat carrier etiquette is what I like to call it. And I'm a buzzkill over this because I don't see it being done very often. So first off, your cat does not want to go on a roller coaster ride. And if you're someone that works in animal welfare or in the veterinary field, please do not carry cats like this as well. I wish they didn't have handles on them to set up humans for success. But this is what ends up happening. There is no cat in here. But many cats can be overweight, and the caregiver or the animal professional is trying to get the cat into the door, and they're holding the cat and they're opening the door, and the cat literally hits a door or a wall or their thigh numerous times. And I cannot imagine how terrifying that is. And also, your cat doesn't want to go on a roller coaster ride. So many cats have nausea and other uncomfortable feelings associated with travel. If I got car sickness or nausea every time I went in a car, for sure, you guys, I'm getting on some meds and working with somebody, because I'm not going to be able to be nauseous every day. It's the worst feeling ever. So we hold cats like beautiful gifts that they are to prevent the roller coaster all over the place, to prevent them from hitting things by accident, but also from a safety standpoint. I know it's happened to people, I've heard, and things happen, but the carrier breaks and the cat gets loose. None of us want that. So not only is this better for your cat's mental health and physical health, but it also helps to prevent them from accidentally getting away if the carrier breaks. So beautiful gift, not roller coaster ride, right? And then again, we're not going to pull or shake a cat out of a carrier. Again, I'm a bit of a stickler on this because it hurts my heart every time I see it. And I'll be honest, I went to tech school a while ago, but this is what I was taught to do. So we're getting better, right? It's beautiful, it's great. But we don't pull or shake cats out of carriers. Instead, we assess their body language and take the carrier apart. So this is just an example of me taking the carrier apart. If I'm working with a fearful cat, many of you probably aren't handling fearful cats, but I am going to work with another person, and using a towel and another person using gentle control and towel restraint to place a towel in that carrier as the other person I'm working with, I'm communicating with them, and they're lifting the top apart. In the rare cases, the carrier can't be taken apart, because I hear this, and I work in vaccine clinics and shelters and vet clinics, and it's not that common, but in the cases where they're rusted shut or zip tied shut because that caregiver is doing the best they can with what they have, in many cases, I'm going to use a lure or a treat to try to get that cat out, or using gentle control. Still not appropriate to pull or shake a cat out of a carrier. But then I'm going to also provide that caregiver with a carrier, because I'm going to be honest, vet clinics and shelters have tons of free carriers that have been donated. Set that caregiver up for success and provide them with a new one, right? And then again, when they first arrive at the shelter or veterinary clinic, keep the carrier high. So if you're at a vet clinic, that cat should go onto the exam table immediately. Or if you're in the lobby, which ideally we would just prevent the lobby altogether, just hang out in the car until the vet's ready to bring you into the room. you're going to elevate that cat's carrier on a chair. We're not going to put them on the floor, right? So cats feel a lot safer when they're higher. And also using a towel to minimize the visual stimuli. A lot of us have been hearing about this in pheromones to help minimize the visual stimuli. Little things make a really big difference. And then we're not going to stick our fingers in the cat carrier, right? I might, if the cat's body language is fairly relaxed or just subtly anxious, I may open it up. And as I'm getting my history, see if they want to explore, or using, similar to this photo here, those are my two cats, using treats to lure them out of the carrier. So when it comes to travel, happy car rides are important. I'm going to talk a little bit more about them later. Again, covering that carrier with a Feel Away infused towel and placing it in a secure area. So I like to put it behind my passenger seat, put them on behind my passenger seat on the ground, because it's very, very stable. And it also helps to prevent humans from doing this, because most cats don't actually enjoy that. I think it's more for us. Or you can place them in the back seat with the seatbelt, again, secure. Play calming music in the car or in the vet visit. When I go to shelters, I have this on my app because they may not be familiar with these techniques. So there's things I can do no matter where I go to reduce stress. I'm going to play classical music or a purr app. Purring is a self-soothing sound. And when it comes to traveling or medical procedures, it's a small thing that can help. I'm going to cool or warm the car to a comfortable temperature. So I'm from Ohio. In the winter, I have heated car seats, and I don't know how I lived without them for so long. Cats run warm. And if the car is heated up ahead of time, that temperature adjustment is less. So again, super simple thing, makes a big difference. Avoid feeling rushed. If you're like, I get it, life happens. Trust me, I have 100 jobs. I understand. But if you're like, I have a meeting right after my vet appointment, blah, blah, blah. We're going to schedule when you're not rushing. Because if you're rushing, even if you're awesome and skilled and have all the credentials I do and teach this for a living, I'm going to like subconsciously move faster and abrupter and be more stressed out. So just kind of plan that time and notify the vet hospital when you arrive. A lot of vet clinics are doing this currently, which is great. But when you arrive in the parking lot, maybe contact the vet and say, hey, because they might be running behind because emergencies are doing their best. And you can just hang out in your comfy car area. And as soon as the exam room is ready, they can contact you or come get you, and you can go right into the exam room and just avoid that stressful lobby altogether. So again, lots of simple things that you as caregivers can make a really big difference for your cats and the cats in your care. Other things I recommend is teaching your cats cooperative care, which cooperative care is just essentially training your animal to not only tolerate husbandry, which is what we call grooming, blood draws, exams, husbandry, and medical procedures, but to actually be an active, willing participant. So as you can imagine, there's some training that goes into this, and it's a more preventative thing. You can start it even when your cat has had negative associations, because I teach this for a living and work with quite a few animals that have, but you're setting that cat up for success. So cooperative care isn't spoken about a lot with cats. So I just wanted to share a few examples of what it looks like. So this is my cat Malt. She gets injections for her arthritis. And her consent behavior, so it's essentially if she comes off the mat, that's her saying no. If she is on the mat, that's her saying yes. So we've trained this before we actually did the injection. We broke these down. But again, I just wanted to kind of share what cooperative care is. And hey, you guys can work with people like me and even look up things that you can do to help veterinary care be better. So my cat loves her injections. She's still hanging out. She's not running or trying to get away. Here's an example of an amazing client I'm working with. And she's currently in the training, but she's training her cat to happily accept teeth brushing. So her cat chooses to come to her and puts her face to the toothbrush. And now her mom starts to actually brush the teeth. But again, she's not chasing her cat or holding her cat down. Her cat is playing a part in that care of that teeth brushing. And we're actually training duration of the toothbrush. So she's treating her after each. Here's an example. My cats are medication trained, so I say meds. And again, we've worked together to do this. She's so cute and I love her so much. So again, she chooses to come here on her own. I always am using considered approach, which is approaching from the side. Again, I've broken down each step and paired it with something she likes. She chooses to stay here. And then we end even on a positive note. But again, all my cats are medication trained. So not only do they enjoy medications, but sometimes it'll be, we give meds at 9 generally. And you know, the day goes by and Bean will be on the counter. That's her station, similar to Malt's mat. And she'll be vocalizing. And I'm like, oh, this is so great. I have an alarm on my phone, but my cat alarms me to let me know when her meds are due, which is even cooler. I love it. Bean meds. Happy vet visits. So not all veterinarians offer this, and I know it's not spoken about with cats as often, and this is more of a preventative. So if your cat has like severe fear and stress at the vet, they need more behavior modification with a trainer, a veterinary professional that is credentialed or understands behavior. But if you have a new kitten or a younger cat, or your cat hasn't really had any negative experiences at the vet, I highly recommend happy vet visits. So it's literally just going to the vet, usually when they're slow. So usually at the end of the day or over lunch, and there may be an exam, because with cats can be harness trained. And in some cases I will do that. But in most cases, we're taking the client to a room and the cat just gets treats at each step. They get things they enjoy. I hide treats in the room for them to explore and find. As a technician, I might spend a minute or two. Again, no medical things are happening. They're just coming, they might get on the scale and I give them churu. I might play with them on and off the scale with a super cool wand toy. Again, they're 5 to 15 minutes. They're not very long, but we're just saying, hey, every time you go to the vet, scary things don't happen. Or even if your veterinarians are doing everything they can to reduce fear and stress, when you go to the doctor, you usually don't feel good and you associate that feeling with the doctor, right? So just bring lots of different treats. This is just an example of, I do kitten kindergarten and this is a shelter and I'm doing a mock exam. So I'm breaking down the steps. The cat's getting a treat throughout. I give them treats with syringes to help form a positive association with syringes when they're very young. And I'm assessing the kitten's body language and making sure that they're feeling good and they're not stressed, because if they're stressed, that means it's not happy anymore. Here's another example of a kitten that I was working with in kitten kindergarten. And you can hear the classical music in the background. And we're working on some clicker training in the exam room. I have all the color hair. Love it. And you're going to see her brother's in there exploring. He's a kitten, obviously. And he starts, I think he pops up at the end, like, I want to play the training game. Oh, there his little head was right there. So again, just, hey, we're going to come to the vet and it's just a happy vet visit. And we're going to explore the area. In kitten kindergarten, I work with vets and I have kitten kindergarten in the veterinary clinic when they're closed. So the kittens can actually explore the veterinary hospital. But again, most cats, their only experience with veterinarian offices, guys, is rough. They don't feel good. It's bad. We're poking and I mean, we're doing our best, but really, they really don't have any positive experiences that are purely positive. So happy vet visits is a great thing to do preventatively. Another thing you can do, bring your cat's favorite bed, brush, treats, and toys. I know this sounds like a given, but I've talked to so many of my cat behavior clients about these things and how to advocate for their cats. And even their vets who weren't familiar with these techniques, they saw how much better the cats did. And now not only is that client's cat doing better at the vet, but other cats are benefiting from that. Because again, addressing the emotional well-being of animals, we're still new to that as a society and in humans for that matter, right? It's great that it's happening, but it's slowly, right? So this is my cat Malt. she's on an elevated surface. You could see she's on a non-slip surface and a towel, and that's her licky mat, and she's enjoying it between the vet as the vet tech gets their history, right? Here's another example. My cat Bean, her favorite bed is her heated cat bed. So yes, that is her heated cat bed plugged in. Why not, right? I like heated things too. And we're just working on some targeting behavior she knows and some clicker training games between the vet, the technician just got the history and we're just waiting for the vet to come in. She's so cute. Here's another example. Again, the vets I work with utilize a lot of these techniques already, but I'm still going to, I know my cat's favorite things. So I'm going to bring squeeze cheese. I spray myself with Feel Away. I have a licky mat. I'm going to bring other ways to feed my cat. Some cats don't want to eat off a syringe or a tongue depressor. So I might bring a licky mat or a different type of substrate that they prefer to eat off of, right? I might bring their favorite toys, a Zoom Groom. That's one of Malt's favorite things. So I bring that. Bring it. Yay. Little things make a big difference. And some considerations. So many of you probably have amazing veterinarians and I love it, but I do think it's important to, because sometimes it can be hard. And a lot of my caregivers are wonderful and they're like, where do you work? And so I think just like how it's really important to understand how to find a credentialed positive reinforcement science-based trainer, which I love that they're covering having webinars about that, because it can be really hard if you're not in the field. Like me finding a car mechanic, I know nothing about cars, you guys. I trust my mechanic. So when it comes to finding a veterinary professional and a trainer, there are considerations, but these are a few that I came up with for when finding a vet. I am a huge fan of fear-free, cat-friendly, low-stress handling certified professionals. There are a lot of amazing practices that may not have these certifications that still utilize touch gradient, gentle control, avoid forceful handling, like 3 people holding a cat, scruffing and stretching it. Like that's not ideal. And there's really no need for that now that we have additional skills in handling as veterinary professionals. So again, those are good places to start. Fear-free happy homes, find a fear-free certified veterinary practice or a fear-free certified professional, catfriendly.com, that's another one. Observe how the veterinarian and staff members work with you and your cat to reduce stress. So for example, when I'm working with a client, I'm explaining everything I'm doing because they might just say, because clients are trying to help and they're like, oh, you could just pull them out of the carrier, and they're trying to help. So I use that as an educational opportunity. I'm like, this can be really scary and not safe. And it's really normal to have anxiety at the vet. I have anxiety at the doctor. And then I take the carrier apart, which takes me 30 seconds. And then they see that, and then they don't force their cat in because they don't know how to get their cat in the carrier. And the cat comes in stressed out, the poor caregiver scratched up because they put them through that door. And they actually see a different way to get their cat in the carrier in an emergency before training. So again, these things are really helpful. So observe how your veterinarian and staff members work with you. Check on professional accreditations and experience. Ideally, they should have registered veterinary technicians on staff. Similar to human nurses, I had to go to a school. I had to take a board, like a certified test, and I have to keep up with continuing education. So again, those types of things are really important. Make an in-person visit, right? If I always tell my clients when they're finding new vets, especially because I work with a lot of clients virtually in other states where I may not be as familiar with every vet practice. And I say, hey, just make an in-person visit, check out the location. Is it some basics, right? Is it clean? Do they seem organized? And I know that seems like a given, but guys, it's in all fields. So those are things that you can check. Find a veterinarian who shares your philosophies about cat care. So for example, addressing pain and treating pain, addressing emotional well-being, providing referrals when needed, those types of things, because nobody, including me, knows everything. It's a team effort. And lastly, trust your gut. I tell caregivers all the time, I feel like I'm a great trainer and I have a lot of clients that love me, but I may not be a good fit for them due to various reasons, and that's okay. It is okay. I have tons of wonderful colleagues I can refer them to. Or if you might not like that vet's communication style, they're wonderful veterinarians, or they may not be super comfortable with handling fearful cats and your cat has a lot of fear. Again, this isn't saying that that veterinary technician or that veterinarian isn't awesome. They may just not be a good fit for you and your cat, and that's okay. Totally okay. So these are just some examples of what fear-free, low stress, because not everyone may not be familiar with what that looks like. So these are all me. I just record everything I do, but these are just a few examples. So this is me in the beautifulness of a foster, because I work with shelters and vet clinics. And you can see I have everything ready ahead of time. So I have hiding places. I have various reinforced toys, playthings, treats. I have everything. Oh, I have the vaccines ahead of time. The foster's working with me and I'm like, can you use this toy instead? Because that moves more like prey, and you see the amount of focus that changed. The cats enjoyed the other toy. And then I'm using a touch gradient and I'm giving a vaccine. And that purring, there's a purring app playing in the background if you can, it's super quiet. But again, cats aren't running away from me. They're not running to get into the carrier that they were terrified to get into. They are hanging out. We had to like continue to play with the cat to get them to come down because we wanted them to come down on their own because I had a lot of other kittens to vaccinate that day. Here's an example of, oh, be my friend. Oh, there you go. Again, I'm using considerate approach. I'm not looming or staring or in front of the cat. I'm using a side approach. That cat's on a non-slip yoga mat over, and then there's a towel over that. There's no reason for a cat to be on a cold metal table or a human. Thankfully, I have not experienced that at a doctor's office as a human. I would hope not. But I see a lot of cats on cold metal tables, guys. It's a bummer. And I just continue to examine him, kind of palpating, and oh, he's so handsome. Here's another example.
Yeah, she's got some fun. Purrs. Oh, the purrs. I love it. You got it.
And this is a cat, this is my cat, and we've worked a lot on applying these techniques every time she has any medical care, and I've worked on stuff at home. So at this point, she actively eats with minimal to no stress, which is essentially cooperative care for her blood draws, which is great. So you're going to see that there's no reason for me to put the cat in lateral in an unnatural position to obtain their blood work. So she's allowed to sit sturdily, which is more natural, like a sit position. The technician applies alcohol with a gauze and doesn't drown her leg in it because that's a really aversive, smelly smell. Cats don't like it. We're using something called a butterfly, which is what they use in human medicine to draw blood. So if my cat moves a little bit, that technician still has access to that vein. Oh, you're so cute. There's a lot of other things. We have everything ready before. Again, a lot of other things that I do, but it results in care like this, and it's awesome. She's so cute. She's like, what are you doing? Oh, okay, I'm gonna go back to eating. Whatever. So just some examples of what that looks like. And then I just wanted to make a note about, especially with cats, this is really important. Many people bring a cat home from the vet and then their cats all of a sudden strongly dislike each other and they contact me, which is great that they're reaching out for help, but it could have been avoided altogether. So when it comes to cats, they communicate via scent. So when your cat goes to the vet, they have other scents on them. And I always use the analogy of if my husband came in with a really realistic mask, like looked like another person, I may perform an aggressive behavior towards him, right? So for cats, this cat not smelling like them is kind of like a stranger cat just being there. And in some cases, it can actually result in a aggressive incident where I've seen cats who were bonded completely, we've had to start over due to that negative association, or the other cat was injured, not just emotionally, but physically. So always when you're returning your cat from the vet, bring them into a room, open the carrier, allow them to explore. And then in some situations, you can let them out right away. You might wait a little longer, but managing the situation by controlling the reintroduction. So for example, I'm going to have treats and toys and supervision. When I open the door, I am going to be giving treats and toys and be able to redirect as needed. And we want to remember the 3-second rule. If one of my cats comes up to my cat and sniffs for longer than 3 seconds, I'm going to use a toy or a treat to redirect him, because that is a lot of sniffing and in that cat's face, and that might then result in a paw smack or a hiss. So again, usually as long as we provide a safe haven and allow that cat to kind of go into a different room for sometimes only 5 to 10 minutes, sometimes longer, depending on the situation, but managing that reintroduction where it literally might be just, hey, I have stuff, I'm assessing, I'm redirecting and supervising. It makes a really big difference. That's Norman. So thank you guys all for being here. I really appreciate it. And thank you for caring about your cats. They love you, as you know. And make your vet appointment today. Your cat will thank you, of course. And then here's some information. I'm on Instagram and Facebook, and I share a lot of tips and tricks like this. And I also have body language and pain resources on my website for free to download. So if you are looking for resources, please don't hesitate to check those out.
All right. Would you like me to read the question in the Q&A?
Oh, no, I can see it. Okay.
Okay.
So they asked, is it okay to hold your cat by the scruff of their neck while supporting their butt so they're not hanging it all by their weight? So I'll be honest, I don't scruff cats, and I haven't in over 7 years. And again, kind of like I touched on, we've learned a lot more about handling. We call it practicing shelter and vet med because we're always improving and learning more, which is awesome. I was taught to scruff cats as a technician a long time ago, but we've learned a lot, and now we understand that scruffing actually escalates fear and stress in cats, and in many cases doesn't really provide us much safety from a handler standpoint as well, because in many of the cases I've seen where people have gotten bit, they were scruffing a cat and don't really have much control over that cat. So instead of, I don't scruff cats, but I understand, including myself, that's what I was taught to do. So I instead work with that cat as an individual. I assess their body language, and similar to all those videos that you saw, I was restraining those cats, but sometimes in our brain, restraint is forcing and holding them still. And that's where scruffing or sitting on a dog, which are things that we don't do anymore in a lot of progressing veterinary medicine. It's things that we've gotten away of because we realized that, oh, it's normal for that animal to move a little bit. If I hold them tighter, they're not reacting to the poke. They're actually reacting to me using more force, which makes sense. So instead, I would ideally not recommend scruffing a cat. And instead, if you needed to transport them and they were fearful, using a towel. But again, towel restraint is a skill, because I see a lot of people they might read a blog that says burrito your cat, when actually that cat would do a lot better if you just used in your home setting, for example, if you just used a treat to lure them to an area, gave them some treats or a long lasting treat on a licky mat, and approach them from the side. I've worked with, even in Facebook and Instagram lives with a few of the general public, I've shared some of this stuff like in the moment, and they went to do it and they're like, so my cat did so much better. But in many cases, we don't even do that. We just automatically use force, which is what causes them to have more stress. But I have quite a lot of articles and resources, because I can go on and on about that, on my website, or you can also go to my website and email me, and I'd be happy to share those with you. So, because again, I know a lot of us, that's what we were taught, but again, we're progressing away from that. But I can go even more into the whys and what to do instead.
Are there more questions? If you have some, you can pop them into the Q&A or into the chat if that's easier for you.
No pressure, everybody.
I can ask a question in the meantime. So you had mentioned if you have an older cat before, how long would you say it might take to kind of change your cat's behaviors going to the vet if you put some of these things into practice?
So the good news, even in the situations where I've worked with caregivers whose cats have had pretty severe aversions to the carrier, for example, they, even without us even doing, because there's more in-depth behavior modification, like classical counter conditioning techniques that we use to essentially help change your, because I can't just say stop being stressed. Hopefully no one's telling you that either, but there's actual techniques that we could use to help address their stress and change their underlying emotional response about how they feel about that carrier. And sometimes just buying the new carrier and leaving it out in a place and it not only coming out when terrifying things happen and them getting good things in it, just that simple step, even with cats who've been horribly scared of carriers, it's made a really big difference. So that's a really good question. It's based on the individual cat, of course, of how much we would break that down. But I've worked with a lot of cats who've been fired from veterinary clinics due to fear aggression, or who have been hesitant to go to the vet because it caused them so much stress, that it caused their, that their cat was so stressed. And we implemented a few of these things, not even the more in-depth behavior mod, and there was a huge decrease in stress and fear. So even these small steps, if your cat is a senior and has had lots of maybe not great associations with things, these small steps can make a really big difference. Okay, I'm seeing all the questions. So someone mentioned, what if your cat doesn't like treats? At what age should your cat start getting twice a year vet visits? We consider cats, and what I mean by we is the American Association of Feline Practitioners, consider cats a senior at 7. So, but if your cat has, you may have a younger cat that has a medical issue, and they may need to see the vet twice a year for that. But from a senior standpoint, 7 is where we would love to see twice a year vet visits. And then someone wrote, my cat is very afraid when anyone comes in the house. Any advice on how to help him be less afraid? So in regards to if your cat doesn't like treats, we have to kind of break that down, right? So I meet a lot of veterinary professionals who they have treats for dogs and not for cats. And they're like, they don't ever eat. And I was like, because none of you are, I mean, I'm not trying to be rude, but I'm like, because none of you are giving them treats ever, because for some reason cats are seen differently, even from cat lovers. I don't really get it. So why doesn't your cat like treats? Because if your cat is fearful or stressed, they won't eat. So that's data, right? Or that treat might not be high value enough. For me to go out in the winter in Cleveland, if my friend's like, do you want to grab a salad? That is not reinforcing enough. If they're like, do you want to grab beer and pizza? I will leave my house for that. So when it comes to stressful environments like shelters or vets, it's really important that we bring the really good stuff. And also, even if your cat doesn't like treats, kind of like I mentioned in one of the slides, where if your cat has a lot of fear and stress, you can still bring their treats or bring other cats like other things. Like, do they like to be petted? Or like the things I was doing with my cat in between the vet visit. Do they like to play? You can still do the carrier and low stress travel tips, because a lot of cats arrive to the vet already very stressed out because the carrier and car ride was horrible. So you'd be surprised the difference in just those little steps. Like, again, I've worked with clients whose cats have been fired from vet clinics, and we just did those few steps, and that cat arrived at the vet clinic with a fear, anxiety, stress score of 2 versus 5, which is where the best and safest thing for that cat is for us to sedate them, which is still helpful. So I would just consider all that. And then when it comes to your cat being really afraid of anyone coming in the house, so that's a more in-depth question. It sounds like your cat may have some generalized anxiety, right? So it's not just situational, or it might just be when new people come over. So the first few things I would recommend is providing a safe place for your cat. Hey, when people come over, we're not going to make you interact with them because it just makes it worse. So you just get treats and puzzle toys and fun things in a safe place with calming music when people come over as management, so we don't worsen it. And then people won't bother your cat, and then your cat will feel safer. And then working with a behavior professional to help address the underlying causes of that anxiety, because that's a more in-depth thing. Kind of like if someone's like, hey, I'm afraid of all these things, we can start with providing me a safe place and not forcing me to hang out with people, but we're going to definitely have to work together to kind of break those things down. Oh, Debbie mentioned, who was talking about the treats, she's already being awesome. And she's like, they don't like these treats, but they do like catnip. So you're already thinking, right? There's so many things that we can do. It might be cat grass or silver vine, or again, their favorite toy. There's a lot of creative ways that we can help to make things less negative for our kitties. So awesome job. Someone asked about what resources would you recommend us to share with a clinic? I hate to seem to step on anyone's toes. I train my cats, awesome, and practice cooperative care. But in case of my inability to go to my current clinic, what can I share with the clinic I'm not a regular client at? So that's a really great question, because again, we definitely don't want to be rude and we want to be professional, but also we have to advocate for our cats. So just like if you guys have kids, it's the same thing. You have to advocate for your kids, but be professional and respectful, right? Always. So in that case, I think I would, even when I went to the ER, unfortunately, just an example, 2 months ago, and I teach this, so it's a little easier, right? But I stressed I said, do not scruff my cat. I mean, I was a little more abrupt because I said, I was very direct because I said, do not scruff my cat. This again, where we're talking about identifying triggers and things, right? So I didn't say, you should never scruff cat. I didn't make this a whole thing. I just said, my cat, please do not scruff my cat. Instead, this, and this, because they were triaging her. So I couldn't be there, which is appropriate. They were super busy. That is definitely appropriate, but I'm still going to advocate for my cat and kind of say, hey, this is what works best for her. And they still may not do it, but sometimes some things are out of our control. So I think always doing that, and then mentioning, hey, at past vet visits, her medial saphenous, like this is where they usually draw blood and it's her most preferred spot. Again, I would love to hear that. Even before I knew about all this stuff, I would love if a client told me stuff like that. So I think in those cases, that's best. If you want to have that clinic maybe start to practice cooperative care or fear-free, at that point, I would just say, you can send them some websites or some resources and say, hey, I've noticed, again, don't make it a whole, because I've noticed a big change in my cat's care since they've been with these techniques. Have you guys heard of it? You could check it out here and just leave it at that, not push it. But that's a really great way to kind of plant some seeds. And they might already have been interested, and getting that feedback helps to get more buy-in from that practice. Oh, I love all the questions. What high value treats do you use? So again, I know this is my answer a lot, but it's always based on the individual learner, right? So when it comes to high value, you should be assessing if they're high value before, like if I'm training something or even taking them to a vet visit, I'm not trying them there, right? We're trying them in but what I mean by trying is offering my cat to see what they find high value. So a few of my favorites, and when I say that, the cats I work with favorites is Churu it's a classic. It's good stuff, you guys. They don't pay me, but it's good stuff. I love it. There's a lot of different flavors. It's lickable, which cats really like. Whipped cream. So again, in moderation, of course. Whipped cream, butter in moderation, small amounts, of course. And then anchovy paste. So this is a hit or miss. Anchovy paste and marshmallows are a hit or miss, but when they are liked, they are very liked. And those are things that I don't think people think of as much. And then the Fancy Feast fillets, they're like, essentially, I think they're a few bucks and they sell them at most places. And it's just fish that can be taken apart really easily into small pieces. It's really smelly and disgusting. The smellier, the better. Those would be a few of my go-to, as in the cats I work with, high value treats. Let's see. If you bring the blanket or toys to the vet, can you bring them back into the house? Like, is there a bad bacteria? Good question. So, you could definitely bring them back into the house. When it comes to veterinary visits, if your cat is going into an exam room for a 30-minute vet visit, we clean the exam room between patients. So the likelihood of that is essentially 0 to none. And kind of how we bring our cat carriers back in. That's a really, really good question though. So that is not something you have to necessarily worry about. You could always, if you're really worried about it, when you bring your cat home, toss the towel that you use in the wash or something like that. But we always clean exam tools and the tables in between patients. So you do not have to worry about transfer of bacteria, but great question. So do you think regards to the lovely person who has a fearful kitty for when strangers come in the house, she asked if she should work for a behaviorist. We do give them a safe place. Awesome job, Debbie. To be at home when people come over, but we would love for him to be less afraid. We have had a pet sitter come for a week or more and he barely comes out. So I love that you're doing the safe place. That's wonderful management. I do recommend working with a behavior professional because I don't think a lot of people, like, I'm a certified cat behavior consultant and I'm a KPA CTP that works with both cats and dogs. And there's not as many, I'll give you that, but I don't think a lot of people are aware that there is help out there for cats with these huge fear of vet visits or medical procedures or strangers coming home, even though you've done a great job at managing it. But of course, you want your cat to be more comfortable with everything. So veterinary behaviorists are awesome, which you can go to the Association of Veterinary Behaviorists on just Google, or you can check out IAABC. They have certified cat behavior consultants, which is what I am, as a few places to try to find someone to help, or your veterinarian may have someone to refer to. And in most cases, they will be from those similar places, but those are great places to start. The good news is there is a lot you could do, and reaching out for help is an awesome second step since you've done such a great job at providing your cat a safe place already. Party.
And I just shared too, in the comment to that question, that San Diego Humane Society does also have a behavior hotline. So I will share that information in my thank you email to everybody tomorrow, along with the recording.
Awesome. We love San Diego Humane.
Are there any other questions? All right.
Awesome. Well, thank you so much for everyone attending, and thank you to Fear Free and San Diego Humane getting this important information out there. I appreciate it.
Thank you, everybody, for attending this evening.